A glimmer of hope in the war against the pandemic from a drug used to treat lupus and malaria. It's being touted by President Trump as a treatment for coronavirus, and our government has struck a deal to bring it here for infected people.
180 countries have cases of COVID-19. More than 885,000 people have been infected. The death toll has risen to above 44,000, but more than 185,000 have now recovered.
Australia has one of the highest rates of coronavirus testing in the world, allowing the government to collect helpful data. So let's break down that data. This graph shows the number of cases since January 20. You can see there was a sharp rise through mid-March. The curve is starting to flatten, but health authorities warn we can't be complacent with social distancing rules. This graph shows Australia's coronavirus cases across age groups and gender. The most cases are among young women aged 20 to 29. There are also a lot of people infected aged 60 to 69. The majority of patients across all states were infected with coronavirus overseas. These are the cases in dark blue. In aqua are the coronavirus cases acquired in Australia through contact with confirmed cases. Light blue represents the cases of coronavirus contracted in Australia where the contact can't be identified. This is likely community spread. The cases in grey are under investigation. This graph shows where Australians contracted coronavirus overseas. The majority were infected after recent travel to Europe and the Americas. A huge number contracted coronavirus on board cruise ships. There are very few cases from China as Australia began blocking arrivals from mainland China from the 1st of February.
Let's go to our team of reporters now. Olivia Leeming is in Canberra. Olivia, former doctors and nurses are being called on to join the front line.
Yeah, the message to them is we need your expertise to help fight this pandemic. 40,000, not only doctors and nurses, but as well midwives and pharmacists are being added to this register. They can return to work as early as next week if they choose to, if they've retired or they've taken a break from practicing in the past 3 years. So they won't be forced into it, but we know many have already volunteered, wanting to help. As well, today the federal government announcing plans to upskill registered nurses, so there'll be 20,000 training courses available so that they can work in those intensive care units. Now, all of this will be done online, but we heard the Chief Nursing Officer tell you just a short time ago that that will be adequate to give them the skills they need.
We've been doing online training in nursing for a very long time. The courses come in a set of modules, and it's self-paced, and it's a whole range of ways in which nurses can be educated in order to help them work in a high dependency unit or an intensive care unit.
Those extra skills so desperately needed now that we know the government is moving to double the number of ICU beds to make sure the health system can accommodate that expected surge in coronavirus patients. Koshi?
David Woywood is in Melbourne. David, the CSIRO has begun the first stage of testing vaccines.
That's right, Koshi. This team at the CSIRO is now moving into that animal testing phase on 2 potential new COVID-19 drugs. Now, it would work by injecting ferrets with these potential new drugs and then infecting them with coronavirus. Researchers would then monitor both their immune and respiratory responses. Now, all up, scientists believe that this process could take around 3 months or so, although they are cautiously optimistic of developing a vaccine.
We know from a disease very similar to this called SARS, which emerged in about the mid-2000s, that there were some vaccines, some prototype vaccines in animals actually caused more disease than if we had not vaccinated the.
Now, overnight, the Australian government has confirmed that it has been in talks with the US manufacturer of a drug the US President Donald Trump has called a corona wonder drug. Now, its name is hydroxychloroquine. It has been used for decades treating malaria patients, and now it is set to be brought here in Australia. So some good news for people suffering from coronavirus here, guys.
And I think that's the one being tested in Brisbane, and Clive Palmer is thinking of buying some of it and bringing it in to help us out as well. Amber Laidler is in Sydney. Amber, there's been a jump in new cases in New South Wales, but the increase is flattening out.
Good morning, Koshi. Yeah, we are seeing those daily figures, those daily number of new cases slowly decline in recent days. 116 new cases recorded overnight. It takes our state's total to 2,298. We know a number of those cases are from people who have travelled from overseas and people who have come into contact with them. The priority now for the state government is identifying the places that are the hotspots for community transmission. One of those clusters has been identified in Waverley Council, particularly at Bondi. The backpackers there identified as one group found to be consistently flouting the rules. Waverley Mayor this morning did confirm that council has been visiting the hostels down there to try and get them on board.
Our powers are limited. We have no powers under the current health orders. However, we are handing out flyers of information, and we are working closely with the Department of Health.
It isn't just council paying these hostels a visit, but also police. Officers were forced to break up a number of backpacker parties on Tuesday night, one of which was in the Bondi area. But the police commissioner confirms these hostels, while they are able to stay open, they might not be able to follow the rules at the same time.
Backpackers at Bondi has closed down. They were working with local council and they couldn't meet the current health requirements, so they have closed. And I think you'll find progressively backpackers will close themselves. You can't have people in these type of environments, particularly if they've only just arrived in the country, in big groups.
The police commissioner also confirming no fines have been handed out. So far, police have just been warning people, but he will be personally reviewing any infringement notices that are issued for social distancing.
Tamara Bowe is at the Queensland border. Tamara, tougher border control measures are being put in place.
That's right, Koshi. From tomorrow, all interstate travel will come to a grinding halt. As it currently stands, anyone crossing from New South Wales into Queensland is allowed to do so, but they must self-isolate for 14 days. But we obviously at this stage still have hundreds trying to do that. And as we head into the school holidays, this will simply be too hard to police. And as the Premier explained a little earlier on, if you do not have a permit and you do not have Queensland number plate, you will not be allowed to pass.
We've got a very strong message for people in the southern states. We love you. Don't come at this time. Let's get through this together, and then when it's finished, you're more than welcome to come back and enjoy a holiday in Queensland. But we're in unusual circumstances, and I make no apologies for making that tough decision. So from tomorrow, no permit, no pass.
Now, the only exception to the rule will be that emergency personnel and freight services will still be allowed to cross the border quite freely. As for how long these strict border control measures will be in place, well, the Premier has warned they are here to stay and they will be in place for as long as needed until we can curb the virus. But we should expect the border to be closed for at least the next 6 months.
To Bianca Stone in Brisbane. Bianca, there are calls for Queensland to even tighten the restrictions further.
Koshi, that's right. Bob Katter wants to effectively cut the state into isolating North Queensland from southeast Queensland. Now, it's an idea that does have some merit. There are some doctors in Townsville who say it should happen, considering most of the coronavirus cases are here in southeast Queensland. To get his point across, the Maverick MP hired a plane, flew a banner over Brisbane yesterday with a message for the Premier saying, "Premier, isolate North Queensland now." The Premier, though, she is not listening to Bob Katter. She says we are all one state. This is not going to happen. What she's thrown her support behind is a care army, similar to the Mud Army back in 2011 when the floods hit Brisbane. She wants volunteers to put their hands up and go and help our most vulnerable people. That's our seniors. Already a couple of thousand people have decided to do just that. Koshi?
Amanda Backman is at Adelaide Airport, where that cluster of cases has grown, Amanda, and there are fears hundreds of people could have been exposed.
Good morning, Koshi. That's right. That cluster is growing. There are now 13 people associated with it. 11 of them are Qantas baggage handlers and 2 are family members. A further 107 Qantas staff members are in isolation as a precaution. The government says at this stage there are no plans to close the airport, but they recommend that anybody who's travelled through here should be wiping their bags. As well, the testing criteria has been expanded. If you've travelled through Adelaide Airport over the past 14 days and you show any symptoms of COVID-19, you should get self-isolated and you should go and get a test. Yesterday we saw an additional 30 cases, bringing our tally to 367 here in South Australia. SA Health is employing an additional 300 staff to track and trace those victims as well as their contacts. They've also this morning just released a heat map which shows the council of Mitcham Council area just south of the city has the most cases at between 30 and 34 cases.
And Nathan Templeton is in Templestowe in northeast Melbourne. And Nathan, emergency services really been put to the test by a fire at a nursing home overnight.
Yeah, very much so, Koshi. The unsettling scenes here last night really illustrated the almost impossible scenarios our first responders are facing at the moment. There was a fire at the nursing home. Thankfully, it was minor and everyone was evacuated with no injuries, but it meant that we had about 100 elderly people placed close together while the building was checked for a number of hours, and they were surrounded by dozens and dozens of not just nursing home staff, but also paramedics, SES, fireys and police, all in close proximity. Many of them touching the residents and some of them without masks and gloves. So totally understandable that the social distancing protocols would be breached in this kind of situation, but nonetheless, it means that the very vulnerable people here were exposed, as were emergency services.
From a social distancing point of view, the COVID-19, obviously that's something we sort of take very seriously. It becomes very difficult in this sort of environment. It was one of the considerations when we first pulled up on scene and checked to see whether there were any known cases in the site, and we were advised that there were no known cases, and they've been in lockdown for a little while as well.
Now, the other issue the fire highlights is why we have to keep our infection rate down, because if all our hospital beds are full of coronavirus patients, what would we do with people like the elderly here last night if this situation was much worse?
Yeah, really good point. All right, team, keep us updated. Thank you. Here's Nat.
Well, the first of 3 planes filled with critical medical supplies arrived in Australia overnight. Andrew Forrest's Minderoo Foundation chartered the flight and has committed $160 million to help fight coronavirus. 2 more planes are due to arrive tomorrow and Saturday, bringing more than 1 million face masks, 400,000 surgical masks, 2.3 million gloves, 100,000 nasal swabs, 200,000 overalls, 10,000 goggles, 5,000 touchless thermometers and 33 ventilators. And Andrew Forrest joins me now from Perth. Morning to you. Why have you decided to help in the fight against the virus?
We've had hospitals from around Australia, and particularly here in Western Australia, contacting us in some desperation, of very heavy emotion in their voices. Their frontline workers are suffering. People like Leanne, who rang a radio station yesterday in tears that her friends from ICU intensive care have not been able to get sufficient protective gear. And we know that we have a network across China. China's the biggest manufacturer of these goods in the world, and they're being monitored by every other country. And I want to make sure that Australia is right up there in China's priorities, and I think we have achieved that.
Yeah, being one of our biggest miners, you've got a few friends up there. Is that what you use to get it out?
I'm using everything, but I can say China's been great mates to Australia for ages, and when I contacted people I know all across Beijing and across Shanghai and across all of China, they responded to the call. Now they're getting immense pressure from organisations, say like the Trump administration, but we're making sure Australia is in there. We're utilising our personal friendships made over 20, 30 years and ensuring that these critical things like N95 masks, almost impossible to get. Washington made a big song and dance about getting 160,000 N95 masks in. We had over 1 million land last night, and we're going to be continuing that push so our frontline workers are getting looked after well.
Yeah, because so why has there been such a shortage if someone, you know, in the private enterprise like you can use your contacts and get it out? We've seen in the news that big companies are shipping it from Australia back to China.
Yeah, look, I think that was an error before we really knew how bad it was. We are getting the Chinese stepping up now. Look, this is relationships driven. We've stepped up for China. We've defended China in difficult times over the decades. China is now saying, hey, you're good mates of ours. We see you're in trouble. We're going to work hard to help you. There's more than money at stake here. Long-term relationships matter. And so we're helping the West Australian government. We're helping the Commonwealth through our relationship, through our drive, through our ability to procure cash on the spot, I'm afraid it's the only language up there. Bank letters of credit, forget it. There's high-risk procurement, but we're there utilising our relationships, supported by government, to say, hey, put Australia first.
Well, it pays to have friends in high places. Andrew Forrest, we thank you for your time this morning.
Thank you very much, Nat.
Yeah, it will be put to good use. Yeah, shows you what works, doesn't it?